and welcome back to the Morning Blend with our continuing series, Insurance 101 with Sovereign Select. Well, you've heard this before. Medicare's annual enrollment began last week on October 15th, and it runs through December 7th. Likely you've been inundated with mail, commercials, and phone calls, right? So today, independent Medicare broker Julie Lucy is here, and she's going to help you eliminate the confusion and make sure you are on the right plan for your own healthcare needs. Good to see you, Julie.
Good to see you too, Tiffany. Great to see you.
Absolutely.
Yeah. One of the ways that we can eliminate confusion regarding Medicare is that we do no-cost consultations for people that are turning 65, for people who might be over the age of 65 and who are thinking about changing plans. The nice thing about Sovereign Select is we're independent agents, meaning we work for the customer. We don't work for the company. We represent almost all the Medicare plans in Milwaukee so that we can customize a plan for your healthcare and your financial needs. Now, these consultations we're kind of still in COVID, and I'm flexible. We can do them online, we can do them in person with some social distancing, or we can even do them over the phone. One way that people are saving money during the annual enrollment period is by people changing from a Medicare supplement to a Medicare Advantage plans. Medicare supplements go up about 10% or more a year. Sometimes there's one rate increase and sometimes there are two. By the time you're in your 80s, you can be paying over $300 for your Medicare supplement. And that does not even include your prescription drugs. So people like the medical advantage plans because they have a very low premium. They also offer free dental, free vision, a gym membership, over-the-counter products, etc. So that's a big way of saving money. I've saved people over $2,000 by switching from a supplement to an advantage plan.
Wow.
And it's absolutely phenomenal. And I think one of the greatest changes during next year's Medicare season, or what we're enrolling people right now during annual enrollment period, is there's something called the Insulin Savings Program out there. And it's the government's first attempt at trying to control prescription drug costs for seniors. So for seniors that are on insulin, they will pay no more than $35 a month for their insulin. So for some people, that's $4,000 savings a year. For some people, that's well over $1,000 of savings per year. What you want to find out is not all plans have this insulin savings. So if you want to, give me a call. We can see what plans offer it. And again, during the annual enrollment period, we can change you from the Medicare plan you're on to one that offers the insulin savings. So it's a great attempt to lower the cost for seniors.
I think people are going to be so happy to hear that, Julie. It can mean so much to someone to save that kind of money. And I know you get calls all the time from people thanking them for educating them and for helping them save so much money. What else do you recommend for people turning 65 this year?
Okay, so people right now are evaluating their group health plan, deciding, what plan to go with. If you're still working and over the age of 65 and on a group health plan, you should really compare Medicare to that group health plan. Medicare is less expensive than 80% of all group health plans out there. So definitely give me a call. We can do a comparison and make sure that, if your group health plan is the best, great. But if Medicare is less expensive, that's a great option for you. The other unfortunate thing is obviously we're still dealing with COVID, and there's been a lot of downsizings from small companies and large companies. We've read about it in the paper. And when people have been downsized, they have the option of taking COBRA. COBRA, unfortunately, is very, very expensive. And again, if you're over the age of 65 or 65 and older, what you can do is give me a call and we can compare your COBRA plan to that of being on Medicare. And in most cases, Medicare is the least expensive cost. And the last thing is really arm yourself with education. We do these free Road to Medicare classes every couple times a month. And it, will teach you basically when to sign up for Medicare to avoid penalties, the A, B, C's, and D's of Medicare, what's best for you, a supplement or an advantage plan. And again, we can do these over the phone, in person, or online. So there's a lot of options out there for you and how we can get together and make sure that you're on the best plan possible.
I love it, Julie. I'm going to make sure everybody's got that information, especially for those classes too. Thanks so much for joining us today.
Thank you. Have a great day.
You bet. And again, make sure to arm yourself, as Julie said, with education by attending one of her free Road to Medicare meetings. They can be done virtually or one-on-one over the phone. They're happening Friday, October 30th and Friday, November 13th. Then Monday, November 20th as well. No specific insurance company plans will be discussed there. It's a general overview. But to contact Julie Lucy, here's how you do it. Just give her a call at 414-253-3554, or you can email her at julie@jlmedicare.com or go to her website. It's jlmedicare.com.